Dr. Isabel Northington with Bella Therapies. I was asked by a good friend of mine for some recommendations on how to alleviate groin and hip flexor pain. So this one's for you, Justin. Sometimes when we are sedentary and we work out, we can actually develop contractures here in the hip. So one of the things I wanted to discuss today are some really cool stretches you can do to help alleviate that. Now the trick is to hold out the stretch long enough. As long as you don't have any knee pain, you can do a pretty aggressive stretch in a half kneel position. So basically this is to get the hip flexor. If you have pain at your iliopsoas muscles, hip flexors, you can actually come down. If you have knee pain, be very careful. You want to get a wide stance on your foot, and then you never want your knee to come over the toe. So if the knee is here, that's not correct. You want a big, big spread of the legs, and then you really want to focus on this muscle, tendons, ligaments, all being stretched here. And then the trick is to hold it for 2 minutes if you can. At that time, you can get some vasodilation, and that increases the blood flow to the area for a more permanent elongation. So you just hold here, and lapse time about 2 minutes. You should feel a melting and a lengthening here. Of course, you want to do bilaterally. Sometimes one hip is more tight than the other. I would recommend doing the tighter hip twice. And this is something that I would recommend daily until you get a nice elongation here and that groin pain is gone. The next technique you can use is just a basic butterfly stretch. You'll come here, bring the legs in, and you can flex forward and stretch, or you can come in and have an upright posture and stretch this way, and again holding for 2 minutes. The next stretch is also a test we do in physical therapy called a Faber's test, and it stands for flexion, abduction, external rotation of the hip. And this one you might need a friend to help. You actually come here, be careful not to put pressure on the knee, and you'll actually lay back, and your hip should actually fall neutral with the opposite hip. If it's really high up here, you know you've got a contracture and it's really tight. You can have someone give you gentle overpressure and counter hold this opposite hip here, and then really try to breathe into it and allow this to stretch and elongate for 2 minutes. And then of course you want to do the opposite side as well, and make sure that whoever you have helping you doesn't force the hip down, doesn't push it down too rapidly. It should be a nice gentle hold. Okay? And then one of the greatest things for musculoskeletal balance is to make sure that your hip muscles are equally strong as your hip flexor. So you want your glute muscles to be strong. So another way is to make sure when you take a step that you're getting elongation here. So you can do activities that help strengthen your gluteal muscles. And I would recommend doing in the elongated position. So you can wrap a TheraBand around your leg and do hip extension exercises this way, because that'll strengthen this muscle, and then that'll help with the musculoskeletal balance of your hip flexor and hip extensor. So hopefully that's helpful. Justin, let me know if you have any questions, and good luck. Thanks for watching.